Hello everyone. So today the topic of our discussion will be blindness and its epidemiology. सबसे पहले हम पता करेंगे कि blindness क्या है, लेकिन blindness से पहले एक important चीज़ है कि epidemiology क्या है. अगर हम epidemiology blindness की find करना चाहते हैं तो उससे पहले हमें पता होना चाहिए कि what is epidemiology. So moving on to the next. What is epidemiology? It is a branch of medicine that deals with the study of incidents. कोई disease किसी भी population में occur हो रही है, ठीक है, उसकी स्टडी करना, इट्स डिस्ट्रीब्यूशन, वो किस किस एरिया में उसने अपना इफ़ेक्ट किया है, या वो डिज़ीज़ जो कहीं पे प्रेजेंट है या कहीं किसी न्यू जगह पे एक न्यू डिज़ीज़ आई है, उसने कहाँ कहाँ कौन कौन से एरियाज़ को इफ़ेक्ट किया है, एंड द पॉसिबल कंट्रोल ऑफ डिज़ीज़ इन अ डिफाइंड पॉपुलेशन, और उसी पॉपुलेशन में आप उसको कंट्रोल कैसे कर सकते हैं. इट इज़ एपिडेमियोलॉजी. सो ओवर हियर यू कैन सी दैट first of all what we have to do, we have to assess the health of the population. हमें एक population देखनी है. For example, the population we are living in, हम उसकी सबसे पहले चेक करेंगे कि उसकी health कैसी है. Are the people over there healthy or ill or something? First you have to assess the health of the population. Then what we have to do, then we have to determine causes of any health problem. We have to see that if there are any causes of the problem, what are the causes. अगर कोई disease किसी भी population में हो गई है तो अब उसके causes क्या हैं, वो क्यों हो रही है, and then we have to implement and evaluate the solutions. फिर हमें अगर कोई disease किसी area में हो गई है तो उसके causes क्या हैं और उसको हम prevent कैसे कर सकते हैं. This is all under the study of epidemiology, right? So first of all, we have to see that IAPB global estimates of vision loss. Before going into the blindness, we should know that how many people are affected worldwide with the blindness, right? So globally, 1.1 people were living with the vision loss in 2020. When a survey was done, we came to know that in 2020, 1.1 billion people were affected and they were having vision loss problems. As we have to study blindness and its epidemiology, that what is the reason of blindness and how we can prevent it further, how we can give the solutions to the blindness. So before going into that depth, we should know okay, how many people are affected worldwide, right? So 1.1 billion people were affected with the vision loss and were having vision loss, out of which 43 million people were blind. हमारे पास 1.1 बिलियन पीपल जो थे उन्हें विजन प्रॉब्लम्स थी, राइट. सो उनमें से 43 मिलियन पीपल जो थे वो ब्लाइंड थे. दे वर हैविंग नो परसेप्शन ऑफ लाइट, राइट. And further 295 million people have moderate to severe visual impairment. We will discuss what is the difference between blindness and visual impairment and normal vision and mild, moderate and severe visual impairments and near visual impairments. But right now what we are discussing is that people, 43 million people all around the world from 1.1 billion population were blind. 295 million people have moderate to severe visual impairment and 258 million were having mild visual impairment. And near visual impairment is that they have problem while seeing near objects, right. So there were 510 million people out of 1.1 billion who were having near visual impairment. So बिफोर गोइंग इनटू द ब्लाइंडनेस हमें पता होना चाहिए कि एक नॉर्मल विजन क्या होती है, विजुअल इम्पेयरमेंट क्या होती है, ब्लाइंडनेस का क्या होती है. वी शुड नो द डिफरेंस बिटवीन ऑल दीज टर्मिनोलॉजीज, राइट. एंड we should know that what is the severity, what is not the severity of the vision loss, right. So there are 5 level of visual functions which are normal vision. The person whose vision is normal or whose vision is okay, that is a normal vision or normal vision person, right. Mild visual impairment थोड़ा सा मसला है, right. मॉडरेट विजुअल इम्पेयरमेंट थोड़ा सा मसला जो हो रहा था उससे अब थोड़ा ज़्यादा बढ़ गया है. सिवियर विजुअल इम्पेयरमेंट मतलब अब जो मसला हो रहा था उसने ब्लॉक कर दिया है काम जो उसके डेली रूटीन के थे किसी पर्सन के, राइट. वो हमारे पास मॉडरेट टू सिवियर कैटेगरी में आ जाते हैं जब हम एक पेशेंट जो है वो नॉर्मल काम मुश्किल कर रहा है, ठीक है. ही इज़ फेसिंग डिफ़िकल्टीज वाइल परफॉर्मिंग हिज डेली एक्टिविटीज़. माइल्ड में हमारे पास इतना इशू नहीं होता पेशेंट के पास, दे आर फेसिंग इशू बट इट्स नॉट दैट मच. And ultimately if the things are not treated, if the problem is not treated, it will lead to the no perception of light, or what we say that no usable vision. The vision which has, there is no vision in the patient's eye, that will lead to the blindness. अगर हम किसी भी प्रॉब्लम को ट्रीट नहीं करेंगे तो वो सवेयर होती जाए. So now over here we are going to discuss that what is the normal VN? So the VL acuity between 6 by 6 to 6 by 12, it's Snellen reading, right? So 6 by 6 to 6 by 12 is termed as normal VN. ये हमारे पास Snellen की रीडिंग है कि ऐसे पेशेंट जिनकी VL acuity 6 by 6 और 20 by 20 हो, वहाँ से लेके 6 by 12 तक उनकी Snellen reading हो, तो it's the normal VN. Now it's not if a patient is having 6-9 VN or 6-12 VN, so they are really impaired. No, it's a normal range of the VL acuity. If a patient is having any uh, refractive error, we can treat it and a patient can come back to its normal VN, right? He can attain 6 by 6. So this is why they are normal VN category. In normal VN, what happens? The rays of lights are focused on the retina, and you can see over here in the picture the images which is seen on the mobile and the image which we can see is normal, right? So it's just an example that how normal VN can appear. Now, what is VL impairment? The partial or total inability, any loss or abnormality of VL perception is termed as VL impairment. So normal VN was from 6 by 6 to 6 by 12. So over here it is any partial or total inability, right? Total or partial inability. A person cannot do his work properly. Of the VL perception, which work properly he cannot see, he cannot perform his daily activities properly. ठीक है, and he cannot use his VN as much as he used to, or that is not benefiting him. So that will get into the category of VL impairment. Patient's eyesight cannot be corrected to a normal level. So that is why I have said that any patient who is having refractive error can be corrected, can gain the VN or normal VN again. But the patients with VL impairment cannot get the normal VN, cannot be 6 by 6 in any case, can be caused due to decreased VL acuity or field. It can be due to the decreased VL acuity. If the patient's VL acuity is decreased and decreased and decreased, then there will be a certain time. And why the VN decreases? These are because of, we have read already that there are a lot of problems, physiological problems that can cause to the refractive errors. So if the refractive errors aren't treated, there will come a point that it will cause VL impairment. And there is the problem in the VL field, that is the constriction of the VL field. The patient's VL area is constricted, and it can also induce low VN and blindness. So the VL impairment can cause low VN and blindness in the patient. What is low VN? It is a category again which can be related to the blindness but is not total blindness, right? Patient has some VN, and we can enhance that residual VN of the patient. That is the category of the low VN, but we are not discussing over here the low VN right now, so we'll just move on. So what is now blindness? So according to WHO, the VL acuity of less than 3 by 60, it's of Snellen. 3 by 60 means that if a patient cannot see on 6 meters, we are reducing the distance, right? So from 6 meter, we have to go to 5 meter, then 4 meter, then 3 meter. And still patient cannot see on the 3 meter, right? So that is the case, that is a category, and WHO, World Health Organization, has classified that person who cannot see at 3 meters, even though he can't see the he cannot see that 60 cent. 3 by 60 means that at 3 meter he is reading the word which a normal person can see at the 60 meters. So he cannot see, it means that he is classified, or he is categorized into the blindness category, and corresponding VL field loss to 10 degree in better eye. Now what does this mean? That VL field is reduced and in better eye with best correction. It means कि आपने हर possible correction patient को दे दिया, but still patient VL acuity is not improving and he cannot see much better than the 3 by 60, and the VL field is reduced so much up to the 10 degrees in the better eye, right? So there is no usable VN. Patient is not capable or not able to see his from his eyes, right? So if we say people who are blind NPL, we don't say that aapko nazar nahi aa raha, you are blind. We say that it's NPL, no perception of light, patient cannot see. So what we are saying, that there is the patient who has the VL acuity of 3 by 60 or less than 3 by 60, and the wheel field is reduced to 10 degree. So there is another classification that if you don't have any appropriate chart, or there is no Snellen chart, there is no logmar chart, then how you can say that there is also other way to know. WHO says that the ability to count fingers in daylight at distance of 3 meters. If you don't have a Snellen chart, or if your Snellen chart is fixed, so how can you know that a patient is either blind or not? It is that the inability to count fingers in daylight at distance of 3 meters. So I have already told you over here that 3 by 60 means that the test is performed, the Snellen is performed at the distance of 3 meters. So over here, the same over here is written that on 3 meters, patient cannot count his fingers. Patient cannot count the fingers, right? We know that if patient cannot see 6 by 60 letter at 6 meters, or 4 3 2 1, so we go to the counting fingers, that is he capable, or is he able to see the fingers. So अगर patient counting fingers भी appreciate नहीं करता 3 meters पे, then we can say that he is blind. So this indicates the visual acuity of less than 3 by 60 or its equivalent. So counting fingers at 3 meters is equals to the 3 by 60. Now, what is the causes of blindness? I have discussed already that we are studying blindness and its epidemiology, right? So in epidemiology, I have said that in a well-defined population, we are studying that if is there any disease present. So what was that disease? Blindness. We have discussed that what blindness is. Now there is a next step that we understand that what are the causes of that disease. So if we were discussing blindness, now we are seeing that what are the causes of the blindness. So there are two basic causes. You can see over here in this diagram, there are different type of disease. Like the most basic or major cause of blindness is the cataract. So over here you can see that there is glaucoma, age-related macular disease, corneal opacities, childhood blindness, diabetic retinopathy, trachoma, and onchocerciasis, and others also. But there are two basic causes of the blindness, and that are avoidable cause of blindness and the non-avoidable cause of blindness. Because we are again, I'm going to tell you that, remind you that we are discussing epidemiology, so we have to see that what is the cause of disease and how can we prevent that cause. So that is why we are discussing two major causes, which are avoidable cause of blindness and the non-avoidable cause of blindness. These all diseases are classified under these two basic causes. So what is avoidable blindness? Factors or condition that leads to vision loss but could have been prevented or treated if timely and appropriately measures are taken. So what is happening over here? Avoidable, with the name you can know that something which can be avoided, right? That blindness, that cause of blindness, or that problems which can be solved or prevented or treated timely, right? Or if the appropriate measures, appropriate treatment was taken, patient could have has his normal VN, right? So that are the factors which is in the category of the avoidable blindness. These are related to the preventable eye diseases which can be prevented or treated, and conditions that with proper medical care could have been avoided. These include all the untreated cataracts, right? If patient has hypermature cataract, their eye can get to, if it's a child, it can get to the um, amblyopia, right? And if it's adult or older patients, what will happen if cataract can lead to the glaucoma, and the vision can loss, permanent vision loss can occur. And then uncontrolled diabetes can lead, if the diabetes is not controlled, so it can lead to diabetic retinopathy, and diabetic retinopathy can cause damage to the retina, the main part of the visual function, right? The main part that is having all the uh, basic functioning, right? So it can lead to the damage to retina, and damage to retina means blindness. Refractive errors, if refractive errors are not treated, so what will happen eventually? Patient's eye will get some serious complications, and it will again lead to the permanent vision loss. Then there is injuries, any injury or eye which can be prevented. We can correct all these if the diabetes would have controlled, if cataract would have treated on time, if refractive errors would have been corrected, or if we have made ourselves so much safe that we don't have any injury. we could have prevented. Now over here you can see this is hypermature cataract. No, it's mild to moderate cataract. It's moderate cataract basically. You can see if it is left untreated, it will undergo hypermaturity, and later on it will cause glaucoma. And this is diabetic retinopathy. It is affecting the fundus directly. Now, what is the role of public health? Now, because we should know that what in epidemiology, what is happening, there are public health uh, cares and people who are working in bundles or in groups, and they are helping people to aware. So what is over here happening? Public health efforts focus on addressing these avoidable causes of blindness through education. They educate people, they give awareness to the people. Early detection: if the disease is detected early, we can prevent it. Access to eye care services: they can provide eye care services to the people so that they can have timely preventions of the disease or solutions to reduce the incidence of real impairment and the blindness. Now, what are the non-avoidable causes of blindness? It is with the name you can see that something which cannot be avoided. So the factors or conditions that lead to vision loss or blindness that are beyond an individual's control or cannot be prevented through medical treatment of or lifestyle changes. That something or those diseases or those problems that cannot be treated, right? That can not be treated medically, surgically, and like they once damage is permanent. So you can have glaucoma example. जितने एक्सॉन सेल्स हमारे आई में रेटिना में एक्सॉन गैंग्लियन सेल्स की डेथ हो जाती है ग्लोकोमा में, we cannot recover them. So the loss which is done with the loss which occurred once cannot be recovered. So these are all the non-avoidable blindness causes related to congenital or genetic factors. These are all the genetic or congenital factors. They can be congenital glaucoma, or there can be genetic factors में हमारे पास आ जाएगा कोई भी प्रॉब्लम जो genetically पेशेंट को जीन्स की वजह से हमारे पास from parent to offspring travel हो रहा है. From degenerative disease, it can be Stargardt's disease. There is a degeneration of cones over there. It can be retinitis pigmentosa. There can be the damage to the pigments of the retina that are rods and cone cells, and it can be due to the age related changes. That can be age related macular degeneration, changes in the eye that cannot be reversed or stopped. Once glaucoma, retinitis pigmentosa, and age related macular degeneration occurs, it cannot be recovered because they are all the damage to the retina. Retina is very sensitive layer, so if it is damaged once, it cannot be recovered again. So here you can see it's glaucoma. Glaucoma's basic representation is that there are very fast glaucomatous progressive sorry there are very progressive and chronic changes on the optic glaucomatous changes on the optic nerve head, which is cup to disc ratio is changed. And over here you can see that it's age related macular degeneration. The macula is affected over here. Now, what are the epidemiological fact determinants? That which are the factors that are affecting the blindness? That are the major cause that are leading, right? Leading to that will lead to the blindness. So these are age, which can be in older patients or in younger patients. What are the problems which occurs and they can lead to blindness? Sex, it will be related to the gender of the patient, either it's male or female. There are some problems that are more in females, and there are more problems that are in common in the males, so which can lead to blindness too. Malnutrition: if proper nutrients are not available for the people or in any specific population, it can lead to blindness, right? And occupation: if someone is working in factories or other areas, he can have any eye injury, etc. So over here you can see that we have detail of age. In young children and adults, we have problems like refractive error, trachoma, malnutrition, and conjunctivitis, which can, if these are not treated, they can lead to the blindness. In old patient, we have diabetic retinopathy, cataract, age-related macular degeneration, and glaucoma. And in occupation, we have people working in factories, workshop, industries are prone to eye injuries because of the exposure to dust, particles, flying objects, gases, or radiation. So eyes can get harmed from these all things. Sex: high prevalence of trachoma, conjunctivitis, and cataract in women can lead to high prevalence of the blindness in women. If the trachoma, conjunctivitis, and cataract cannot be treated timely or appropriately, it can cause blindness. Malnutrition, severe corneal destruction can cause blindness due to the deficiency of vitamin A. So vitamin A is very important for the eyes. So if a patient is not getting enough vitamin A, so it can lead to the corneal destructions, and ultimately if cornea is damaged, there will be the blindness. Now how can we prevent the blindness? Regular eye examination. If you are doing timely or regular eye examination, you can we can diagnose timely the problem, right? If the disease is diagnosed timely, it can be treated efficiently and timely, and appropriate measures can be done, so we can prevent it, right? And ultimately if a disease is prevented, we will not undergo the complications or severity, right? And preventive care for children, because children are having more chances of getting amblyopia. So if a patient is getting or having amblyopia, so lazy eye can cause blindness, right, if it is not treated. Eye safety and protections for preventing the injuries. Proper hygiene should be taken, because if a patient is having proper hygiene, he can control the chances, or he can control the risk of trachoma. Management of underlying health conditions. If a patient is having diabetes or blood pressure problems, so if he controls that diabetes or hypertension problems, he cannot get further complications like diabetic retinopathy or hypertensive retinopathy. If a person smokes more, so he can if an adult smokes more, older patient smokes more, he can have he is more likely to have the chances of the age related macular degeneration. So avoid smoking and other problems too. And awareness and education is important, because there are a lot of people who are not aware of of these all diseases or problems. So that is why they are very they came to know the disease when it occurs to them, and they don't even take them seriously, so it can complicate other severities, right? Now there are some specific programs that helps us to um, reduce the chances of blindness. So that there are these are the names of the programs. These are VN 2020, trachoma control, vitamin A prophylaxis, occupational eye health services, and school eye health services, in which we have screening and treatment and other health education, so that young people or children should know that these are the problems arising in the world, so they may take preventive measures. Now, what is VN 2020? Because it's something very important or recent program. It ended recently, so we should know that what is VN 2020. It was proposed in 1999, yani 20 years ago. It was proposed that, and it was predicted that the number of blind people will increase dramatically over the next 20 years. यानी 20 साल पहले यह सोचा गया कि जो हमारे पास blindness है that will increase, right? The people will go and will be blind more. Their percentage of blindness will increase if the proper measures are not taken. So at that time they predicted that there will be 75 million blind people until 2020 reach reaches, right? And they are saying that they estimated this, that 75 million people would have blindness until 2020. So that is why they proposed VN 2020 program, or an agenda whose purpose was to reduce the chances of blindness in people, right? So in order to reduce global blindness, WHO and Task Force of International Non-Government Organizations jointly prepared and launched a common agenda for global action known as VN 2020. So they proposed a common agenda they planned and implemented on whole world, that there should be the reduction, or there should be some proper solution to the blindness. So they made a program which was VN 2020, whose core strategies was to control the disease and to develop human resources in a specified area or in around all the world, that हमारे किसी भी area में, किसी भी country में human resources होने चाहिए, like ophthalmologist, optometrist, and opticians. Like these, all the human resources should be provided to a specific group of people, right? Or in all the countries there should be humans, ophthalmologists, services should be provided to them. Development of appropriate infrastructure and technologies. New machineries should be introduced that can help in diagnosis and the treatment of the diseases of eyes that can reduce the chances of the blindness in specified country population. Now we in 2020 के हमारे पास 3 objectives थे. That was awareness of avoidable causes, identify and secure the necessary resources, and facilitate the planning, development and implementation of those strategies we have discussed over here by of 2020 by national level. Like we should implement all these plannings, on the national level. All the countries should do take these measures or implement these measures in their every country, every city and in every province, right? लोगों को आगाही देना कि ये मसले हैं जिनको आप हल कर सकते हैं, जिनको आप सॉल्व कर सकते हैं, जिनकी वजह से आपको ब्लाइंडनेस भी हो सकती है लेकिन आप प्रिवेंट भी कर सकते हैं इस ब्लाइंडनेस को, राइट? सो ये हमारे पास आ जाएगा पहला ऑब्जेक्टिव. दूसरा ऑब्जेक्टिव ये है हमारे पास कि ये हमारे किसी भी पूरे दुनिया में और ऑल अराउंड द वर्ल्ड हमारे पास कौन कौन सी रिसोर्सेज हैं जो हम लोगों को ट्रीट कर सकता है, जो हमारे पास प्रिवेंट कर सकता है ब्लाइंडनेस को बाय ट्रीटिंग, बाय डायग्नोजिंग ऑन टाइम. एंड थर्ड इज़ टू इम्प्लीमेंट ऑल दी कोर स्ट्रेटजीज among the national level. On national level, if every country implements these strategies or objectives, or they take proper measures, or they take there are programs that will aware people, so that can reduce the chance of the blindness. So this was all about blindness and what are the causes and what are the preventions and its epidemiology. So I hope there is not any confusion. So if there is any confusion, you can comment in comment sections, and thank you so much.